Good afternoon, I'm Alan Unell, and this series of videos is Healthcare Advocacy, where we address problems in the healthcare system and then try and take actions to make a better system for all of us. We're going to be talking about a number of issues, cancer and Medicaid, but before we get there, down below in the YouTube description box, you'll find a link to the Healthcare Advocacy newsletter that is the text for today's video. It also contains, the YouTube description box also contains actions that we should take together with references. I would point out that the Healthcare Advocacy newsletter has all of the background material that I use together with medical studies, resources that you can use that are related to healthcare and healthcare advocacy. Feel free to sign up, subscribe for free, get it delivered to your inbox almost every day. All right, let's get started. The first article I wrote about that I'll discuss is because a friend of mine called me and she was incredibly sick. She said she had never been this sick in her life, and she's my age. So that's, a long time to be exposed to sickness. Anyway, we live in the Pacific Northwest, actually in Vancouver, Washington, and pertussis is rampant. I want to give you a little bit of guidance about vaccinations because at all costs you should avoid this. Adults 19 and older should receive a single dose of the Tdap, that's tetanus, diphtheria, and pertussis vaccine. High-risk adults or adults with asthma or chronic obstructive pulmonary disorder, COPD, may be at increased risk and should be vaccinated. Adults working with young children should be vaccinated. Healthcare and childcare workers should get a booster every 10 years. Pregnant women should receive a single dose of Tdap during every pregnancy, preferably between 27 and 36 weeks. P.S. Out here in Portland, we've had 2 kids die of flu. So just get vaccinated. We don't think of the flu as a killer disease, but it is. All of these things are dangerous. Protect yourself, please. Okay, let me talk briefly about pancreatic cancer. It's important to me. It killed my mom. Anyway, pancreatic cancer kills about 50,000 people every year, according to the National Cancer Institute. And there are very few effective treatment options for the disease. Now, in a new study, researchers at University of California, San Diego School of Medicine, so I'm not surprised it's at that university. They do a lot of research into this. Anyway, they have discovered that an enzyme called MICAL2 promotes tumor growth and spread in pancreatic ductal adenocarcinomas, PDAC, the most common form of pancreatic cancer. Now, the study is going to be published, or was published, January 2nd in Cancer Research. And if you go to the newsletter, there's a link to their research. Normally, MICAL2 plays an important role in cell migration and morphology. But when researchers measured gene expression in PDAC tumor cells, they found that an excessive amount of the enzyme was being produced compared with non-disease cells. The first time MICAL2 has been experimentally linked to pancreatic cancer. They also found that among patients undergoing surgery to remove their PDAC tumors, those that had low MICAL2 expression in their tumor cells survived about twice as long as those whose tumor cells produced more of the enzyme. That suggests that MICAL2 may be involved in progressing the disease to an advanced stage. MICAL2 appears to supercharge the KRAS signaling pathway, which regulates cell growth, proliferation, and death, and is known to be the primary driver of pancreatic tumor growth and the spread of the cancer to other tissues in the body. Silencing the MICAL2 gene in the PDAC cells dramatically slowed the activity of the KRAS signaling pathway. When the tumor cells are deficient in MICAL2, the KRAS signaling pathway is unable to harvest nutrients that leads to tumor growth. MICAL2 expression promotes tumor cell division, migration, and the invasion of healthy tissue. The findings suggest that MICAL2 could be a promising target for PDAC drug therapies. The researchers believe it will be possible to target MICAL2 with drugs, as it is an enzyme in a class of proteins against which inhibiting drugs have been successfully developed to treat other human diseases. They're now focusing their attention to identify candidate drugs to begin the journey towards blocking MICAL2 in pancreatic cancer. This could just be a tremendous lifesaver. Anyway, there's a link to the University of California research report there. I want to talk about Medicaid cuts. This one is really important and it has huge impact. The MAGA Republican Trump supporters in Congress are now poised to cut Medicaid funding because if you're poor, it's just too bad for you. Here's the real result. Millions will lose health care because 9 states have trigger laws that will remove their Medicaid expansion if the federal government reduces Medicaid. Did you hear that? If the federal government cuts the Medicaid budget by $1, 9 states will cancel Medicaid expansion, throwing 3 million people off of the rolls. Those 3 million people in 9 states would be at immediate risk of losing their health coverage should the Trumplicans reduce the extra federal Medicaid funding that's enabled states to widen eligibility. This is according to the Kaiser Family Foundation and Georgetown University Center for Children and Families. That's because these states have trigger laws. Okay, the states are Arizona, Arkansas, Illinois, Indiana, Montana, New Hampshire, North Carolina, Utah, and Virginia. The 2010 Affordable Care Act encouraged states to expand Medicaid programs to cover more low-income Americans who didn't get health insurance through their jobs. 40 states and the District of Columbia agreed, extending health insurance since 2014 to an estimated 21 million people and helping drive the U.S. uninsured rate to record lows. 25% of the people who have Medicaid were able to qualify because of the expansion. In exchange, the federal government pays 90% of the cost to cover the expanded population. Now that's far higher than the federal match for other Medicaid beneficiaries, which averages about 57%. For that reason, and increased industry related to the new subscribers, states generally saw no increase in their Medicaid spending when they expanded Medicaid. This is according to the Commonwealth Fund. So they added extra hundreds of thousands of people to Medicaid, but they didn't pay $1 more. Their state budget remained stable because so much more money came in from new jobs and new taxes and whatever. Anyway, but wait, what I'm talking about can become incredibly worse. If Congress cuts federal funding, Medicaid expansion would be at risk in all the states that have opted into it, even without trigger laws, because those state legislatures would be forced to make up the difference that the federal government decides not to pay. This is according to the Kaiser Family Foundation, and there's a link to their report. We need to take action on this. Let's let our elected representatives know that 3 million people will immediately lose their health insurance, and another 18 million will likely lose it, since states would be required to make up the difference if Medicaid is cut. I have a link in the YouTube description box. It'll show you the phone number or email for your member of Congress and senators, or my favorite way, on your cell phone, send a text message, sign, S-I-G-N, space P-O-Q-Z-W-M, sign P-O-Q-Z-W-M to 50409 to send this message to your senators and your member of Congress. I'll read it to you. I'm your constituent, and I see that there's a movement afoot in Congress to cut Medicaid spending. I want you to know what the fallout will be. There are 9 states with trigger laws that will completely roll back Medicaid expansion to the federal poverty limit only. That'll force 3 million people out of health insurance. Additionally, another 18 million will risk losing their health insurance because states that have expanded Medicaid would have to make up the lost federal funds. That's 21 million people. That's a quarter of the people on Medicaid and 6% of the US population. That'll create a significant hardship for them and for our public health systems. I strongly urge you not to enact any cuts to Medicaid. If you're worried about paying for deficits, try having the IRS collect all that it's owed and implement a fair corporate tax. Don't fund the tax cuts for the wealthy on the backs of the poor. Thank you. And then at the bottom of the email, I have a link to all the analyses that I mentioned in our discussion today. That's what I have for you. Down below, you can like, share, subscribe. Please do that. You can also subscribe to Healthcare Advocacy, the newsletter on Substack. Send me comments here or through healthcare by email at healthcareadvocacy1@gmail.com. Have a good evening.